All right, good morning, everybody. I don't know why the camera looks so close to me, but something's changed with the formatting. Anyway, Dr. Rafich here, Vet Triage. Let's talk about how to give your pet medications, and maybe this will help some of you folks out there who struggle with this. A lot of pets are very difficult to give medications to, and they can be quite frustrating. Um, I do have a video on my channel about this as well, so feel free to check that out. And thank you to those watching on the playback. Any questions, any suggestions you guys have, please let me know, and I'm happy to make videos based on that. Otherwise, subscribe and like and do all the things. So, medications in animals. The main reason why you're giving medications in pets is because something is wrong with them. Either they got hurt or they got sick, and you're giving them medications to treat that ailment. Other times, though, there are medications that are more preventative, like heartworm prevention, flea and tick prevention. There are other medications, let's say like vaccines, that are considered prevention. There's also supplementation, supplements like joint supplements, fish oil supplements, to help with various ailments in pets. And so there are many different reasons why to give medications, but most often it's going to be because something is wrong with your pet. You're trying to treat it. Now, medications do come in different forms, as some of you may know from the human side of things, from previous animal experiences. You can have medications that come in tablets or pills, capsules. They can come as a liquid. They can come as transdermal, so you put it on the skin. They can go in the eye. There are some that can be given rectally. There's injectable, and so these are all different ways of giving medications. And then with the injectable route, the injections depend on where you're giving the medication. Most often, it's either going to be under the skin, which is subcutaneous, in the muscle, which is intramuscular, in the veins, which is intravenous or IV or intravascular, and intraperitoneal is giving it in the abdomen, in the peritoneal cavity. IO is intraosseous, giving it in the bone. But the point is that injection has many different categories. Most pet owners are going to be giving injectable medications either never, or in the scenario like diabetes, for example, they're going to be giving it under the skin most often. So anyway, that's those are different reasons for giving drugs and different formulations of the drugs. Now, as far as getting your pet to get medications, sometimes it's as easy as taking the drug, putting it in some food or a treat, and having them eat it. And some pets are not picky about that. You can use turkey or any kind of deli meat, turkey. You can use tuna fish, like canned tuna. You can use cream cheese, peanut butter. They make a specialized pockets called pill pockets that you can purchase, and that's like a beef treat with a hole in the middle, and you put the pill inside or whatever, and then they'll eat that. So that's the easiest way and most common way to give medications. And obviously dogs are going to be more amenable to this than cats are. But yeah, and so sticking it in some food or a treat is the easiest way to do it. Some pets, though, they eat the food and spit out the treat, or they eat around the food, or eat around the pill rather, and eat the food instead. So it doesn't always work in every pet. The second possible solution here is to ask your veterinarian if you can have a liquid version of the medication. It's called a compounded drug. Now, liquid formulations are sometimes made at the vet hospital, but most often they come from a pharmaceutical lab, a pharmacy, and a compounding pharmacy specifically that specializes in making liquid meds, because it's not just a matter of making the medication liquid. You have to make sure that that what it's made of is also not toxic. If you want it flavored or not flavored, if you do have a flavored, what kind, because you don't want to give a pet a flavored medication. It's like flavored, like beef flavored in an animal that has beef allergies, right? So, but you can ask your vet about that. It is probably usually more expensive to get the compounded drug, and also if they're making it from a lab, it's going to probably take a week or two at least to get for turnaround time. So that could be a bit difficult. It may not be realistic for all scenarios, but that is an option as well. And then the same compounding pharmacies typically will also be able to make transdermal formulations of the drug, meaning that they make a formula that you put on the pet's skin, so it's absorbed systemically through the skin. And not every drug is amenable to that. And, out of all the methods that we're talking about to give drugs, injectable works the fastest, of course. Then probably rectal, and then oral, and then transdermal. I don't know where bone fits into that, or intraperitoneal, but it doesn't matter. Those are not realistic for people anyway to give at home. So transdermal, my point is that it's slower to absorb, especially with different breeds of dogs having different thicknesses of skin, unlike people, which we're pretty consistent in terms of dermal thickness. And animals, it could vary widely. Obviously, a Chihuahua is going to have thinner skin than like a Shar Pei, but transdermal is an option as well. The rectal route, giving a medication rectally, is usually reserved for emergency situations, the most common of which, if your dog is seizuring and you can't give them pills and you're trying to stop the seizures, and you give a medication rectally. That way, you at least get it in them, and it's got pretty rapid absorption. But that's also, again, not a very common scenario, and it's only usually done in emergencies. But it is, if we're going to be thorough, it is an option. But yeah, so those are different ways of getting pills into your pets. Otherwise, the reliable way that takes a bit more effort and depends on your skill set, as well as do anybody to help you, and also how amenable your pet is to just pill them. Open the pet's mouth, shove the pill in, done. And that is dependable. You got to make sure you don't get hurt, you don't hurt your pet, all that stuff. So, but it takes some training with that. You can have your vet train you how to do that, or their technician will teach you how to do that. There's YouTube videos on it. There's also devices, these long tubes where you put the pill in there. It's a pill gun, and you put that in the back of the mouth and they shoot it, and that works too. I think probably if you're gonna force a pill down the mouth, you should follow up with some water. So have like a syringe with some water in it, and that way you put the pill in the mouth, close the mouth, and put a little bit of water behind the canine, the gap there, and syringe the water. It makes the dog swallow, and then they'll swallow the pill. And depending on your pet, that may work only once, and then they're never fooled again, or you can keep doing it, and it's not a big deal. But yeah, otherwise, don't be frustrated as a pet owner if you're having difficulty giving medications to pets. They're not accustomed to get medications. They don't want medications. They don't taste like anything, or don't taste good, or whatever. And so frustrations with that is of course understandable. Worst case scenario, if your pet's not amenable to giving drugs, contact the hospital who can have your pet hospitalized, and they can give the drugs injectable, or they can pill your pet themselves, or you can bring your pet to the clinic every day, or however often it has to be to get the pills down their throat. Those are options as well, just not the most realistic, and they're expensive and stressful and all that, but those are options. And then one thing I didn't mention was feeding tubes. Obviously, you can give medications through feeding tubes, but typically if your pet has a feeding tube, you are being taught how to give medications that way anyway. So that's beyond the scope of this discussion, but just to be thorough, that is another way. And there's different types of feeding tubes in the nose, in the esophagus, in the belly. Anyway, that's a different topic for another time. Yeah, so hopefully that helps you guys out. And I know this is mostly focused on dogs. Cats is pretty much the same rules, but they can be a bit more difficult. They have smaller anatomic features. They can be quite wily, and when they don't want to be caught, they don't want to be caught, and so they're running and hiding and all that. So cats are even more tough than dogs. But transdermal is a nice solution for cats if it's realistic for you, because their skin is typically the same and fairly thin. But anyway, it's something to consider for them. And I guess the other medication I didn't talk about really was radiation therapy, but again, beyond the scope of this discussion, because you're not going to do that at home. All right. Anyway, I hope that helps. Any questions, let me know. Thanks to those watching in the playback. Feel free to subscribe and like and share, do all those things to get this going. I appreciate everybody who watches this every day. And sorry, a little late this morning. It's July 5th, about 9:20 a.m. now, Pacific time. I will try to be on tomorrow, July 6th, hopefully earlier than today. And we'll have another discussion to talk about. We'll talk to you guys then. Take care.